In anywhere in life, when you're meeting someone and the impression you create on the other person is within the first few seconds or so. And this applies for the MRCPCH Clinical as well. So when you're entering the room and you've been given a task, whether it is to examine the lower limbs of a patient or to examine the abdomen or the chest, the first few seconds of how you start itself makes a big impression of the examiner. So what do you expect it to do? Now, the common mistake people do is obviously when they're told to examine, for example, abdomen. So they go straight away and jump into the person, and sometimes they forget even to wash their hands with the sanitizer. They even forget to ask permission from the parent and the child that can you please remove your clothes and I got to examine your abdomen. And they straight away go and start palpating the abdomen without even describing what the findings are. And the other common mistake is whether you're palpating the abdomen or you're percussing the chest, you should always look at the child or at the parent and explain what you're going to do. That I'm going to feel the abdomen and tell me if it hurts you, or I'm going to beat on your chest like a drum very gently. Let me know if it causes any discomfort, and then do the examination. So always remember the first few seconds matter. Always introduce yourself, wash your hand, mention that the child looks comfortable or has an oxygen saturation meter there attached to his finger, or if there's a child with a neurological problem, is there a splint around, or a wheelchair around. These small things initially, when you mention that and mention about the fact that the child has to be plotted on the growth chart and whether the child looks healthy or dysmorphic, or whether the child does not look appropriate weight for age, these have to be started first. And then on inspection, whether the abdomen looks distended or the umbilical looks distended, or the chest, whether there is a scar or the chest looks sunk, the appearance looks scaphoid, or the chest looks, there are obvious scars on the chest. These have to be told before you go and start palpating. Hope this helps. Till next time.